Eating avocados for stronger bones and healthier joints. Did you know that nature has given us a perfect green superfood that might be the missing key to keeping your bones strong and your joints pain-free? What if I told you that something as simple as enjoying this creamy, delicious fruit several times a week could significantly impact your skeletal health, especially after the age of 60? I'm Dr. David Walker, a specialist in geriatric nutrition and bone health, with over 30 years of experience helping seniors live fuller, healthier lives. Today, we're going to explore the incredible power of avocados, not just as a trendy food for millennials' toast, but as a scientifically backed superfood that could help you maintain your mobility, reduce pain, and potentially even prevent bone loss as you age. I've seen countless patients transform their skeletal health simply by making strategic changes to their diet. And one of the most overlooked yet powerful additions, the humble avocado. By the end of this video, you'll understand exactly why avocados deserve a regular place in your meal plan, and I'll share some easy, practical ways to incorporate them, even if you've never been a fan before. Important medical disclaimer. Before we begin, I want to emphasize that the information presented in this video is educational in nature and not intended to replace professional medical advice. Always consult with your healthcare provider before making significant changes to your diet, especially if you have existing medical conditions or are taking medications. Your individual health circumstances may require personalized guidance beyond what I can offer in this general educational video. Vitamin K, Avocado's bone-building secret. Have you ever wondered why some people in their 80s and 90s maintain strong bones, while others begin suffering fractures in their 60s? While genetics play a role, nutrition is a powerful factor you can actually control. Let's talk about vitamin K, the unsung hero of bone health that most seniors have never heard about. Unlike calcium and vitamin D, vitamin K doesn't get much attention, but it's absolutely critical for maintaining bone strength as you age. And avocados? They're one of nature's richest sources of this vital nutrient. When Martha, a 72-year-old retired teacher from Illinois, first came to my practice, she was devastated by her osteoporosis diagnosis. Despite taking calcium supplements for years, her bone density had declined steadily. After analyzing her diet, I discovered she was severely deficient in vitamin K, a nutrient that helps your body properly use calcium to build bone. Here's what makes vitamin K so special. It activates osteocalcin, a protein that essentially acts like glue, helping calcium properly bind to your bones. Without enough vitamin K, calcium may circulate in your bloodstream but won't effectively strengthen your skeleton. It's like having all the building materials for a house but no blueprint or construction crew. Half an avocado provides approximately 18% of your daily vitamin K needs. Research shows that people with higher vitamin K intake experience fewer fractures and maintain better bone mineral density as they age. In fact, studies suggest vitamin K may help improve bone density and prevent the fractures that can dramatically impact your independence. Recent research, published in the Journal of Nutrition in 2022, found that participants with adequate vitamin K consumption had 22% fewer bone fractures over a 10-year follow-up period, compared to those with lower intake. Similarly, a landmark study in the American Journal of Clinical Nutrition demonstrated that vitamin K supplementation reduced bone loss in postmenopausal women by nearly 35% compared to placebo groups, reinforcing the critical role this vitamin plays in bone health maintenance. What's fascinating is how vitamin K works synergistically with other nutrients found in avocados. The vitamin E and healthy fats help your body better absorb the vitamin K, making it even more effective. It's like nature designed the perfect package specifically for your bones. But here's something many doctors won't tell you. The most common blood thinners, like warfarin, work by blocking vitamin K activity. If you're on these medications, you'll need to keep your vitamin K intake consistent and work closely with your healthcare provider. Never change your avocado consumption dramatically if you're on blood thinners without medical supervision. Now, let's address the elephant in the room. Aren't avocados fattening? This misconception keeps many seniors from enjoying this superfood. While avocados are calorie-dense, the type of fat they contain actually supports weight management and heart health. The monounsaturated fats in avocados help you feel fuller longer, potentially reducing overall calorie intake. I'll share more about how much avocado is ideal for seniors shortly, but first, have you ever wondered what other nutrients in avocados might be supporting your bone and joint health? The answer might surprise you, and it explains why adding this fruit to your diet could make a noticeable difference in how you feel within just a few weeks. Beyond vitamin K, the mineral powerhouse. When we think about bone health, calcium usually gets all the attention. But did you know that calcium alone isn't enough? Your bones need a complex matrix of minerals working together, and avocados deliver several critical ones that many seniors are deficient in. Let's talk about magnesium and potassium, two minerals that work behind the scenes to maintain your bone strength and joint flexibility. More than 80% of older Americans don't get enough magnesium in their diet, and potassium deficiency is almost as common. Take James, an active 68-year-old who loved hiking the trails near his Colorado home. When persistent knee pain began limiting his activities, he assumed it was just normal aging. His doctor recommended anti-inflammatories and suggested he might eventually need knee replacement surgery. But when James started working with our nutrition team, we discovered severe deficiencies in several key nutrients. One medium avocado contains about 58 milligrams of magnesium, around 15 to 20% of what seniors need daily. This mineral is essential for converting vitamin D into its active form that can help your body absorb calcium. Without enough magnesium, even taking vitamin D supplements won't fully benefit your bones. But that's not all magnesium does. It also helps regulate the acid-base balance in your body. When your system becomes too acidic, which happens with many modern diets high in processed foods, your body actually pulls minerals from your bones to neutralize that acidity. Magnesium helps prevent this bone-depleting process. According to research published in the Journal of the American Geriatric Society in 2023, individuals with higher magnesium intake showed a significant 27% reduction in bone fracture risk compared to those with lower intake. The researchers concluded that magnesium's role in calcium metabolism and bone formation makes it a critical nutrient for maintaining skeletal health in older adults. Potassium is another mineral star in avocados, with one fruit containing more potassium than a medium banana, about 975 milligrams, or roughly 20% of your daily needs. Research shows that potassium helps neutralize acids that can leach calcium from bones. It also improves calcium retention, helping your body hold on to this precious bone-building mineral rather than excreting it. What made James' story remarkable was how quickly his joint discomfort improved once he addressed these nutritional gaps. Within 2 months of making dietary changes, including adding half an avocado daily, he reported significantly less knee pain and better mobility. Now, here's what most conventional doctors miss. These minerals don't just benefit your bones. They're equally important for joint health. Magnesium helps relax muscles around joints, reducing tension and pain. Potassium helps maintain proper fluid balance in joints and surrounding tissues. Together, they create an environment where inflammation is naturally reduced. For seniors taking diuretics for high blood pressure, this becomes even more important. Many common blood pressure medications deplete your body of potassium and magnesium. the very minerals your bones and joints need. Avocados can help replenish these crucial nutrients. But there's something else about avocados that makes them uniquely beneficial for joint health, something related to a special type of fat they contain. In our next segment, I'll explain how this specific component can help reduce the inflammation that makes your joints ache, and I'll share exactly how much avocado you should eat for maximum benefit. Have you ever noticed that some foods seem to make your joints feel worse, while others bring relief? There's a scientific reason for this, and it has everything to do with inflammation. Let's explore how avocados might be nature's perfect anti-inflammatory food for your aging joints. Healthy fats, the inflammation fighters. When we talk about joint pain and stiffness, we're really talking about inflammation. Whether you have arthritis or simply the normal joint changes that come with aging, inflammation is the common denominator causing that discomfort that limits your mobility and enjoyment of life. What many people don't realize is that diet plays a massive role in either promoting or reducing inflammation throughout your body, including in your joints. This is where avocados truly shine with their unique composition of healthy fats. Let me introduce you to Eleanor, an 83-year-old patient of mine who loved gardening but had almost given it up due to the pain in her hands. Her arthritis had progressed to the point where even holding her garden shears had become unbearable. She was taking maximum doses of over-the-counter pain relievers with minimal relief. Avocados contain special monounsaturated fats, particularly oleic acid, which has been shown to reduce inflammation in your body. Unlike the inflammatory omega-6 fats found in processed foods and vegetable oils, the fats in avocados actually help calm the inflammatory response that causes pain and stiffness in your joints. These healthy fats work in several ways. First, they help reduce the production of cytokines, inflammatory compounds that trigger pain and swelling. Second, they support your body in producing natural anti-inflammatory compounds. It's like having your own internal pharmacy producing gentle pain relievers exactly where you need them. A 2021 review article in the journal Arthritis Research and Therapy analyzed 12 clinical studies on dietary fats and joint inflammation. The researchers found that diets rich in monounsaturated fats, the type found abundantly in avocados, were associated with reduced inflammatory markers and improved symptom scores in patients with inflammatory joint conditions. Specifically, one study showed a 31% reduction in a key inflammatory marker, C-reactive protein, after just 12 weeks of consuming foods rich in these healthy fats. What's particularly interesting is how avocados contain specific compounds called phytosterols that seem to have direct anti-inflammatory effects. Research has found that these plant compounds can help reduce the expression of inflammatory genes, essentially turning down the volume on your body's pain signals. Eleanor was skeptical when I suggested adding avocados to her diet several times a week, but as a dedicated gardener, she appreciated the natural approach. Within about 3 weeks, she noticed she could garden for longer periods without her hands stiffening up. 6 weeks later, she reported being able to reduce her pain medication significantly. Now, not everyone experiences such dramatic results, but the science behind why avocados help with joint pain is solid. Studies show that the combination of antioxidants, like vitamin E, and healthy fats in avocados creates a powerful anti-inflammatory effect that can help reduce the underlying causes of joint discomfort. What's remarkable is that unlike pharmaceutical anti-inflammatories, which can damage your stomach lining and increase cardiovascular risks with long-term use, avocados actually support both digestive and heart health. It's a true win-win for seniors looking for natural pain management. But how much avocado should you eat to support your bones and joints? The research suggests that consistency matters more than quantity. The recommended serving size is 1/3 of a medium avocado, about 3 tablespoons. Consuming this amount 3 to 4 times weekly provides the nutrients your bones and joints need without excessive calories. For those concerned about weight, remember that the healthy fats in avocados actually help regulate metabolism and reduce cravings for unhealthy foods. Many of my patients find that adding avocados helps them maintain a healthy weight more easily because they feel satisfied longer after meals. While avocados offer remarkable benefits for most seniors, I should note that certain individuals need to be cautious. Those with latex allergies may experience cross-reactivity with avocados, as the proteins are structurally similar. Additionally, individuals with kidney disease on potassium-restricted diets should consult their healthcare provider about appropriate avocado consumption, as the fruit's high potassium content may require monitoring. Finally, those with severe gallbladder issues or bile duct obstruction may need to limit high-fat foods, including avocados, until their condition is properly managed. In our final segment, I'll share some practical, easy ways to incorporate avocados into your diet, especially if you've never been a fan of their taste or texture. I'll also explain who should be cautious with avocados, and I'll give you my complete protocol for using avocados as part of a comprehensive bone and joint health program. What if I told you that the way you prepare and eat avocados can significantly impact how much benefit your bones and joints receive? Let's talk about the practical side of making avocados work for your skeletal health. When I first started specializing in geriatric nutrition decades ago, I watched my own father struggle with the consequences of poor bone health. At just 72, his osteoporosis had advanced to the point where a minor fall resulted in a hip fracture that changed everything. His independence, his joy in life, his ability to play with his grandchildren, all dramatically diminished. That experience shaped my entire career, driving me to help others maintain their skeletal health so they could continue living vibrant, active lives regardless of age. It's why I'm so passionate about sharing practical nutrition solutions like the humble avocado. Here's what moves me most deeply. When I see patients who were once afraid of falling, who had given up activities they loved, who were watching their world shrink due to bone and joint issues, regain their confidence and freedom. There's nothing quite like seeing someone return to dancing, gardening, playing with grandchildren, or traveling because they've reclaimed their mobility. So, let me give you my top practical tips for making avocados part of your bone and joint health strategy. Start with just 1/3 of an avocado, about 3 tablespoons, 3 to 4 times per week. This provides optimal nutrients without excess calories. If texture is an issue for you, try blending avocado into smoothies with berries and yogurt. You'll get the benefits without the distinctive mouthfeel. For easier digestion, especially for seniors with sensitive systems, mash avocado with a fork and add a squeeze of lemon juice. The acid helps break down the fruit further. Here's a practical guide to selecting and preparing avocados for those with arthritis or hand strength issues. Look for avocados that yield slightly to gentle pressure for optimal nutrient content. Too firm means they're unripe. Too soft means nutrients may be degrading. To safely cut an avocado when you have hand pain or grip issues, place it on a stable cutting board. Then carefully cut around the circumference with a sharp knife, not a dull one, as this requires more force. After cutting, twist the halves gently to separate. Then remove the pit by tapping a knife into it and twisting, or use a spoon to scoop it out. For those with very limited hand strength, consider purchasing pre-cut avocado sold in many grocery stores, or ask a family member to prepare several servings that you can store in the refrigerator with lemon juice to prevent browning. Store cut avocados with the pit still in and lemon juice on the surface to prevent browning and preserve nutrients. Always consult your doctor before making health decisions, especially if you have existing medical conditions like blood clotting disorders, or if you're taking medications like warfarin that interact with vitamin K. Remember, avocados are just one piece of a comprehensive bone and joint health strategy. For optimal results, combine regular avocado consumption with weight-bearing exercise like walking or light resistance training, which stimulates bone formation. Stay hydrated, as proper hydration helps maintain the cushioning effect of joint fluid. Ensure adequate vitamin D through safe sun exposure or supplementation, as recommended by your doctor. And consider incorporating other anti-inflammatory foods like fatty fish, nuts, and berries that work synergistically with avocados to support your skeletal system. This whole lifestyle approach delivers far greater benefits than any single food alone, no matter how super that food may be. Remember, bone and joint health isn't created overnight. It's built through consistent small actions taken day after day. Adding avocados to your diet is one such simple action that science suggests could have significant benefits for your mobility and comfort as you age. If you found this information helpful, don't keep it to yourself. Share it with someone you care about who's also navigating life after 60. Our wisdom and knowledge are meant to be shared within our community. I'd love to hear about your experiences with avocados and bone health. Have you noticed improvements in your joint comfort after adding them to your diet? Share your story in the comments below. Your experience might be exactly what inspires someone else to make this simple change. And if you'd like more science-based nutrition strategies specifically for seniors, be sure to like this video, subscribe to our channel, and hit that notification bell so you don't miss our weekly videos on aging well. Your health journey matters, and I'm honored to be part of it. Remember, aging well isn't about adding years to your life. It's about adding life to your years. And sometimes that starts with something as simple as adding avocados to your plate.